Yeah, you go ahead and do the prayer.
Lord, we just come before you. We know that you are in control. Thank you for all your many blessings, and Lord, in this time, I pray that you would give our leaders guidance and direction, wisdom in the decisions that they make. I pray that you would have your hand upon our county, our state, and our nation. Lord, I just ask that this virus, this pestilence, would dissipate quickly through your mighty hand. Please bless this meeting, bless the employees of our county in these next few weeks and days to come, and bless this commission right now in this meeting. And I pray this in your name. Amen.
Amen. Attention, salute, pledge. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Commissioners, you have before you for new business and unanimous consent, a declaration of emergency conditions in Jefferson County, and a resolution authorizing the director of county manager the council will regular schedule committee meeting on Tuesday, March 17th, and regular scheduled meeting on Thursday, March 19th. Chair will entertain a motion to consider items for unanimous consent.
Make a motion for unanimous consent for immediate consideration of the declaration and the resolution.
Second.
Have a motion and a second. Ms. DeLaBerta.
Commissioner Ammons?
Yes.
Commissioner Knight?
Aye.
Commissioner Tyson?
Yes.
Commissioner Stevens?
Yes, thank you. I'd like to present the declaration, and I will read it. Declaration of Emergency Conditions of Jefferson County. Whereas the Jefferson County has experienced the pandemic virus, COVID-19, which began in China on or around December 2019, and is continuing. Whereas on January the 30th, the World Health Organization has declared a COVID-19 a pandemic and declared the outbreak a public health emergency of international concern. And whereas on March the 13th, 2020, the President of the United States declared a national state of emergency due to the COVID-19 virus. And whereas on March 13th, the Governor of Alabama issued an executive order and declared a statewide state of emergency in Alabama due to the COVID-19 virus. And whereas all the above could adversely affect the health, safety, and economy of the people of Jefferson County, and whereas the existing and increasing possibility of the occurrence of COVID-19 will be beyond the control of the services, personnel, equipment, and facilities of the county, and will require combined forces of a mutual and aid region or regions to alleviate the adverse effects to the health, safety, and economy of the county. And whereas the situation does create emergency conditions in Jefferson County within the intent of the Alabama Emergency Management Act of 1955 as amended. And whereas the Jefferson County Commission has been requested by the Director of the Jefferson County Emergency Management Agency to implement its emergency powers as set in Alabama Code 1975, Statute 31-9-10. Now therefore be it resolved by the Jefferson County Commission that emergency conditions exist throughout Jefferson County, warranting the exercise of emergency powers as provided by law and the activation of the Jefferson County Emergency Operations Plan as prescribed by the Jefferson County Emergency Management Agency Director, as well as all appropriate annexes. In addition, the appropriate county agencies are directed to exercise their statutory authority to assist the communities and entities affected. Be it further resolved and ordered that during the existence of said local emergency conditions, the powers, functions, and duties of the Director of Jefferson County EMA and the emergency organizations of this county shall be those prescribed by state law. Be it further resolved in order that during the existence of the local emergency conditions, all procedures and formalities described in Code of Alabama 1975, 31-9-10-B5 are hereby waived. Be it further resolved in order that during the existence of the local emergency conditions, and without limiting any other manner or method by which a person or entity may be deemed an emergency management worker, all persons or entities tasked pursuant to or at the request of the Jefferson County EMA by or through the emergency management tracking software are subject to the order or control of any agency, department, board, commission, bureau, committee, institution, corporation, authority, or other office tasked by EMA or through its tracking software, shall be deemed an emergency management worker for purposes of Alabama Code 31-9-16.
Move to adopt the declaration.
Second.
Motion's been made and seconded. All in favor say aye.
Call the roll.
Call you, we call roll.
I mean, Commissioners, because this is an emergency meeting, these are not matters of new business. The agenda is set because it's an emergency meeting, so it doesn't require unanimous consent. This is the original agenda for the emergency meeting, so it just requires a regular vote.
Regular vote.
Aye.
All in favor say aye. Aye. Any opposed? Passed unanimously. Commissioners, we have a resolution authorizing the county manager to cancel regular scheduled meetings. That's item 2. Chair will entertain a motion.
So moved.
Second.
Move to second. All in favor say aye.
Aye.
Approval of the minutes. We have the minutes from the commission meeting of March the 5th, 2020. Are there any additions, corrections, or revisions?
Move we dispense the reading of the minutes adopted as written.
Second.
We have a motion and a second. All in favor say aye. Commissioners, you have 47 resolutions that we have been made aware of that were given to by the county manager on Thursday of the prior week. Are there any items on these 47 that we need to handle separately?
I have one. The travel,
Right. Mr. Tellus, what number do you know? What
number 40.
Number 40.
41.
40 and 41. Are there any others? Chair will entertain a motion.
I move that we suspend the travel for employees or non-essential meetings. There are some in this item 40 that have already traveled, and it's over. So I would amend that to say that we adopt and pass those for the reimbursement that's already been traveled. But those that are pending travel, I would move to suspend that until further notice.
That's it. Yes, sir.
Okay, so let's go ahead and adopt 1 through 47, but with the amendment to number 40. Can you do that all right, Bill?
Yes.
All right, so
Second.
we have a motion and a second. All in favor say aye.
Aye.
Thank you very much. That takes us through 41 now.
Have we ever received any information from that Family Dollar? Have they responded to any of the requests for more information?
I didn't hear you.
The Family Dollar, the number was requested a number of times, further information. Is that a Michael question?
I'll go see. It's a Michael question. I do know that a letter was prepared to send to those folks that I assisted in preparing, that we need that information before moving forward. So we can confirm that, but
We're checking.
They're going to confirm.
Yeah, Just to kind of follow up, this has been in front of us many times, and if there's been no more communication, then I move that we just move
We have, while we're waiting on that, we have one other item we have two items we want to consider as new business. The first being, the reallocation of some funds for a storm shelter for the city of Lipton from our, storm shelter funds. Commissioner Knight, do you want to, address that? It's just $147,000.
147,
That's correct.
147,000.
Is that an immediate need?
Yes,
Sir, it allows us to go ahead and move forward with that contract, so that the contract can get its funds and insurance.
Okay, so then I would, have you moved it?
No, I was waiting on,
Okay, that's what it is. It's that allocation that we have budgeted $1 million for the storm shelter construction. And so that part is going to be used to complete a storm shelter that was started under Dr. Hamilton in the community development program for storm shelters. So I would move that we adopt the motion to allocate $147,000 to the storm shelter in Brighton that's
It's
completed.
Lipscomb.
To complete it.
Second.
now that is a motion for the consideration of new business. And I have one other item of new business also, that concerns the, closing of the courthouse. So those would be two items of new business.
I move for unanimous consent.
I thought you said we didn't have to do that, or do we?
No, we
Have to go back and do that?
Just for these new items, not for the emergency.
You had a printed agenda, so any additions to your printed agenda would require unanimous consent.
Okay. Second.
All right, we have a motion and a second. Ms. DiLiberto, would you please call the roll?
Commissioner Evans?
Yes.
Commissioner Knight? Commissioner Scales?
Yes.
Commissioner Tyson?
Yes.
Commissioner Stevens?
Yes. I sent you the right one. Okay, first item would be the reallocation of monies for the Lipscomb Storm Shelter. Chair will entertain a motion.
Move the item.
Second.
Items are moved and second. Ms. DiLiberto, would you call the roll?
Commissioner Evans?
Yes.
Commissioner Knight?
Aye.
Commissioner Scales?
Yes.
Commissioner Tyson?
Yes.
Commissioner Stevens?
Yes, thank you. The next item is, we're in a very fluid situation. And having consulted with the county manager, county attorney, EMA director, and State Department, the Jefferson County Department of Health, like to put forth this resolution for consideration by the commission. Whereas the Jefferson County Commission has joined the state and federal government to declaring an emergency due to the COVID-19 coronavirus epidemic. I'll get it out in a minute. Whereas public health agencies have recommended the practice of social distancing and self-isolation to slow the spread of the pandemic and to assist healthcare providers in keeping the number of those experiencing severe symptoms at a manageable level. And whereas operation of local schools have been suspended until April the 6th, 2020, creating childcare issues for many employees. And whereas it is anticipated that additional orders and recommendations from the state and federal level will make it increasingly difficult to maintain routine operations. Now therefore it be resolved by the Jefferson County Commission that the county facilities shall be closed to the public through April the 6th, at which time we will look and reevaluate.
Mr. President, I have a question too.
All right, she was first, and then you can be second.
Mr. President, I'd like to speak to this resolution. I do want to have an understanding of the impact in terms of our services and employees, if that can be provided before we move on it. If it's not going to have any adverse effect on the employees or the services, and what I mean by services, I'm talking about those that such as like garbage collection and some other things that we know that we need to keep our communities clean, at least, and those things that must continue. I just want to get an understanding of what we're doing.
Yes, first of all, by closing the courthouse and doing this action, the employees will continue to be paid for the,
Okay.
for the 2-week period. Also, we have environmental service, we have IT, we have payroll, we have other functions that will need to continue to operate in the county during the closure. So we'll have key personnel, and we're going to be meeting with our department heads later this morning to determine what positions we need to keep to operate, to continue to operate the county, because we still have to operate
So let me ask this.
those critical functions. So we'll have critical personnel continue to work.
Okay, so do you have some discomfort, Mr. Attorney, before I ask?
No,
my
ma'am,
second
Commissioner, this effectively closes the courthouse to the public. It doesn't do anything. This resolution doesn't speak to operations. There'll be evaluations. What this does is closes the facility to the public, so it limits the public interaction for purposes of social distancing, et cetera. But this resolution doesn't have anything to do with the staffing function. That'll be something that'll be evaluated with the county manager. Some concerns that may come up, we understand there may be some further resolutions from the state to address some concerns that the public may have. But at this juncture, because things are fluid and this was an emergency meeting and we don't know what may happen going forward, this simply closes those facilities to the public.
Okay, and I think that explanation helped me out a little bit more. Mr. County Attorney, one last thing. So I want to be clear, any online services, since that's what we're asking the public to do.
Yes.
Which is to go to our online services. So those persons would be able to continue, we can
Yes.
continue on with our online services.
Yes, anything that is available online will continue to operate.
Okay, and lastly, as we talk about garbage collection or anything else that we just find necessity, that's going to be operated by your office, and you're going to make sure that the public knows. I'm really more trying to get an understanding for public consumption.
We don't do garbage.
I'm sorry?
We don't do garbage. Garbage is handled by independent contractor, advanced disposal, and they will continue to operate.
Okay, I'm just looking at some of the requests that comes in, and so by we filtering it, I just wanted to make sure that, but, okay, you've answered it. Because to me, it's no dumb question except the one that you don't ask.
Right.
So I do appreciate it.
Commissioner Dodson.
Yes, I would like to know, will that include Cooper Green and the health department?
Cooper Green has, Laura has done a great job in putting the program together there. The urgent care will continue to be open. As far as patients, the doctors are going to be calling the patients who had appointments today, talking to those patients. Urgent care will be open, but the clinics will not be seeing patients unless it's emergency, and also the oncology group will continue.
Because that's some of the calls that I have received, actually this morning they started, and their major concern was making sure that Cooper Green was open and they can still see their doctors.
Right.
And the Jefferson County Clinic also.
And I think Cooper Green is trying to get established a testing program.
Yes, they are.
So that they can do a drive-through testing.
Yeah,
At Cooper
Along with
Green, so that-
Grandview.
they don't have the,
I know, we don't
yes.
have the stuff to do it yet. When will this be effective, this closing?
Close the business today.
Okay. Now, people that's coming to get tags, you know, it'll get toward the end of the month and there'll be a surge of people need tags because of they're going to expire. And I remember the last time we had some kind of notice that, look, we're going to give some kind of a grace period for renewing your tag, and I would recommend that we look at doing
Things are already underway with that, and we'll remember, I said that there was gonna be some things that would probably come from the state later on today, but we're already moving in that direction to make sure that there won't be any issues there, and also be some meetings with law.
So recordings as well for like probate, mortgages, I mean, folks still doing business, all that will be there. And that'll be put out through Helen on
We anticipate some things coming through the state, but things are moving kind of quickly, so we'll work.
We're in uncharted waters here, guys. We're doing what we can.
Can we make sure we put the number out for emergencies in case a patient need to be seen at Cooper Green?
Yes.
Is it a number that they need to call? Is it any way we can put that out, please?
Yes, we'll do that.
Mr. President,
Yeah, let's go ahead and vote on this motion first, and then we're gonna let all of it. Unless it's.
no, well, I had a question,
Okay.
because I still want to make sure that I'm very clear about something else as it relates to this. I saw you shake your head, Mr. Patella's on the Cooper Green portion of it, but two things. One is, especially since we have this resolution in place about limiting access to this system of contacting folk. I did receive 2 calls this morning and 1 text, and I see the person with EMA, which I'm not going to call him out from the dais. I want to know, as it relates to the precautions that are being taken or need to be taken, are we going to make sure that we distribute information to everyone on that level? Everyone doesn't do social media, so are we going to make sure that the folks who are most vulnerable, which we're talking about as seniors, we want to make sure that those folks are contacted through our EMA service so that they are notified of not only the closings, but anything else, any more information than what I saw this morning? Because that was more like an internal call for the health department at 11 o'clock. But, you know, are we going to try to use this system to make people aware who are seniors, since they're the most vulnerable population? We are.
May I get Mr. Coker to address that, if that's okay with the President?
And I think, yeah, go ahead.
Great question. We're doing several things today. We will use Everbridge to contact everybody that needs to be contacted. The second thing we'll be doing this afternoon is we are going to stand up a joint information center called JIT. And that is where the PIOs from the county, the health department, us, Birmingham, and other cities as we need to, they'll all be in the same facility. One message, one voice.
All right, so thank you. And my last question, Mr. President, is on the, with Cooper Green. I want to ask from this day is that I know that folk are saying you can go to Grandview, but for some citizens, too many citizens, they can't go over there to Highway 280, and I understand that. Are we going to try to have something implemented at Cooper Green where that's more of a centralized location for residents to be able to go to?
Mr. Tell did just address that earlier.
What did you say?
Ms. Hurst is working on a plan,
Yeah.
and, you know, again, we hope she'll have something in place. But we're not ready, you know, she doesn't have the kit, she's working on a plan
You talking about Ms. Hurst?
at Cooper Green, the director.
Okay, but when they do, I'd be interested in knowing that.
Yes, okay.
Okay, I appreciate
Mr.
it.
President, I'll move the item.
All right, item's been moved. Second. Ms. Dillberto, please call the roll.
Commissioner Evans?
Yes.
Commissioner Knight?
Aye.
Commissioner Scales?
Yes.
Commissioner Tyson?
Yes.
Commissioner Stevens?
Yes, thank you. Item 41.
Mr. President, real quickly, are we going to be working on a plan for our employees pursuant to the closing of the courthouse?
Yes.
And that will be distributed as soon as it is completed. This has been a very fluid situation, as you can imagine. We're working together. I guess we were on and off the phone many times yesterday, and I spoke with many commissioners that to try to understand that by text or telephone. Is there any, item number 41?
I got word that there has been no communication from Family Dollar to the county or staff that they requested. So I just missed that.
Well, Mr. President, because that's in my district, and I'm going to respectfully say we need to deny this permit if we are going to move forward with a vote. because of their neglect to,
He seconded.
Second.
I'm sorry?
I second that.
Okay.
Yeah, that's what I was saying, vote.
Item 41, all in favor of the denial, say aye.
Aye.
There you go.
Thank you.
Okay, Mr. Tellis, do you have anything to say? And I'm sure that you should.
No, this is trying times right now, and we will continue to work and work with the commission as we move forward.
County Attorney.
Nothing at this time.
All right, County Financial Officer, I know that we have talked, and I know that Commissioner Knight and I have talked concerning the long-term implications of this commerce slowdown. The county, the municipalities, the school systems, all depend on the sales tax dollars of revenue, which is right now it's spiking, but we need some guidance, and through the limited conversations that we have, we think we probably need to put everything on neutral and to be able to reallocate our resources to where they're most needed for this crisis. I don't know that that's a vote for today, but it's also something to begin to consider. And at our next meeting, perhaps if you would assimilate some data for us so we can make an informed decision, that we could move forward to where we can best allocate the resources for the citizens of Jefferson County with the understanding that we are in perilous times.
We're working on that, Mr. President.
Okay, good. Mr. Tuss.
I have a question before we go to comments, if I may. In the event one or more of us become either positive or develop the symptoms, then that may limit our meeting ability. And I think I asked this question, I think I know the answer, but can we do a virtual meeting or a teleconference meeting and still be in compliance with the Open Meetings Act, Mr. Lawson?
At this juncture, the law recognizes presence at open meetings via electronic device, but it does not allow a person who is being present electronically to vote.
How would that be an Open Meetings Act? Are you gonna let the public and the press access to whatever webinar, teleconference, or something like that?
To be honest with you, Commissioner, we're kind of writing some of this stuff as we go. And that'll be something we'll look at considering. It may be that for purposes of those meetings, that we may have to have an open, may have to be able to allow access for that purpose. Well,
I think it's important because you're right. We're on the ground here, and but we still have to conduct the business of the county, and the commission still has to act as one.
I'll make you up to date as we look at those things. That'll be something that
Sometimes it's better to ask for forgiveness on something like that and do what we need to do. Mr. Todd, we'll go down the line. That's all right. Go ahead.
We have a program set up for public housing that will bring in bag lunches for this week. And they will start the hot meals on, and everything is to go. When you come up, they will give you your meal and you leave, and that's going to help the children that's actually out of school. So this will be in public housing in Birmingham, Bessemer, Brighton, Lipscomb. I'm trying to get the ones that have already agreed to do it so far, and when I go back to the office, we will get the agreement for the other ones. Then they will be delivered by truck, and they will start tomorrow, and they will have hour at each site, each person will be fed. They also will give out hygiene items to senior citizens, hand sanitizers, a couple of, sprays and stuff that for them to actually keep their area clean, because it's a very, it's not that much of that supply, so they're only gonna give it to the senior citizens. And that will be all over Jefferson County. As the locations come in, we will actually give it to the people that will actually be giving that out. Also, if you go to my website, you will see Ignite Alabama, they actually did a Zoom webinar, and they talked about the virus and also about financial situations that we will be in during this time. Also, we have nutrition experts that will be online talking about that and about just self-care. It's a number of things. So it's, we've gotten over 5,000 views. So if you take time, you can actually look at that and be informed. And we will do another one in next week. That's the end of my report.
Thank you. Mr. Hamilton.
I'd just like everybody to be healthy. Make sure you're following the CDC guidelines and doing everything that we're asked to do. It's no reason to say it doesn't apply to me. I think it's important for all of us that if we hit it hard and we hit it now, we can get this taken care of quickly and get back to business as normal. I think we're going to find that at this time, for us to continue to work as a county, we're going to see how important our IT department is. And I think it's going to be a case study for us moving forward. So if something like this happens again, how do we do it and do it better? So a lot's resting on Shree and his folks. Best of luck.
Good.
Thank you, Mr. President. I have a couple of items. My first question is, when we talk about staffing, would our staffs apply to that too in terms of when the courthouse closed? What do we do with our staffs?
Courthouse is at this juncture just close to the public.
Okay, so our staff can continue to come. When do we perceive that, when we say April 6th, is that kind of like a hard date, or that's a moving date based upon whatever circumstances that may arise?
Based on the circumstances.
Okay, so then when we're communicating that with our constituents, we need to let them know that that could possibly change. Am I correct? All right. And so I do want to ask this question, because I've been speaking with several pastors, and including my own church, that would like to participate in doing an extension of what they already do for the general public. So I wanted to know, in terms, I guess this is a Jim Coker question, is can pastors or the administrators participate in the JIC meetings?
Ma'am, the purpose of the JIC is to push information out uniformly to everyone, so they can certainly access to it. We have access to at least receiving the message.
No, what I'm trying to make sure is that if you have churches that want to assist with anything that's trying to help the general public, I don't know if JIC is the answer, but if you can tell me, then where do we direct those pastors to go and to do, just so that they can partner?
So they can contact us. We're establishing routes now to do that. One thing we're trying to do is limit the number of people we actually have in the EOC in the JIC, and that's for social distancing. So a lot of this will be done remotely.
So then what I'm going to respectfully ask of you, Mr. Coker, is that I'm going to organize it, and once we get it together, I'll be calling you directly myself, so that we can get from you whatever instructions that we need to do in order to move forward with it. But there are very much an interest in the faith-based community that want to assist during this time, and so I want to be very clear on that. Thank you. And my last,
All
I'm
right.
sorry.
Let me address that, Jim. While we do that, I just received a text message from Dr. Wilson that he's setting up a call at 11 11 o'clock with commissioners, mayors, and key stakeholders to talk about the plans to dramatically curtail social interaction, at least for a short period of time. They're also planning to ask EMA to set up a separate command structure to assure that community needs such as food are being met. So I think that would be your contact for what's going on. And this is such a fluid situation that we're having, is that we're flying by the seat of our pants. Let's just make sure we don't get bumped off the horse.
Absolutely.
Okay?
Thanks.
All right, so thank you, Mr. President. It seems like, is that the same message that came to all of us about this 11 o'clock call?
Well,
Is that what you're referring
I
to?
don't know.
Okay, well, that's the message that they sent out. That's what I was referring to earlier. And lastly, Mr. President, I did want to ask this of you, Mr. County Attorney, and this is having to deal with commissioners who communicate with one another during this time. Is there any flexibility in the law that would allow us to communicate with one another if there's not, I guess, a formal action to be taken, but for us to at least have a discussion of 3 or more?
I don't know that there's any suspension of open meetings, but by virtue of the Emergency Act, it allows some flexibility in decision-making, depending on what those decisions are. So if you've got some specific concerns, let's talk offline about that.
All right, so my last thing is, as relates to those joint informational meetings, I've been talking, especially being that Commissioner Knight is, falls under his committee as relates to EMA. I do want to say for the record, I am interested in being a part of all informational meetings, so you're hearing it from me directly. I want to be a part of those meetings. I want to be very actively involved in it. I think that we have to have all hands on deck, and everybody has their own way of doing things, and certainly I'm not one to tell anyone else what to do, other than I know that I'm going to be all hands on deck in every way possible. So I want to say that here this morning, so no one would say they didn't know. I'm making it public and on the record that I am interested in participating in whatever meetings, whatever organizations that we develop, so that we can better help the general public. That I want to be there, present, and doing whatever we can, so that and I'm not just interested in my district. Wherever we can help, I want to be there. But at least let me know what those meetings are, when they take place, and you have my commitment. All right, thank you.
All right, now, I'm not sure how that's gonna work on the JIC as far as, because I would like to be involved, and I'm sure Commissioner Stevens and Tyson would be too. So we'll maybe explore that. But that's coming from the FEMA, the state, the local, and because there's a lot of mayors and such out there that need access to the information too. But I agree, the premise is to have us as a county speaking as one voice, so that we don't have all these, who's in charge here. That's going to be centered at the JIC. And I think we were saying that the PIO from Birmingham, PIO from here is going to be part of that. So we'll explore I respect.
Yeah, I'm not interested in being a voice. I can be my own voice. All I'm saying is I want to be a part of those meetings. I want to help. And I know that this is not the time for any of us to use it for any other reason than what it is. Everybody got to be totally committed. So that's all I wanted to do, is just to express that to you as the chairman, that I do have an interest in it. I'd like to be a part of it in whatever way that I can potentially be a part of it. That's all, Mr. Chairman.
Commissioner Tyson, one more time.
Yes, but I received a text from the censors. They say that the college students have been let out of school, so they wanted to remind us that they are to be counted at college, like they're in school. They should be counted at their parents' home. This is a state of emergency. It's the reason that they were released out of school. Some of them will not return back to school until August. So they will be counted, college students will be counted on campus not at your home.
Okay, perilous times. When we took office, I thought that we had just about seen everything from bankruptcy, closing of Cooper Green, tornadoes on various times would come into a culmination in April of 2011. Other times it affected other areas of the county, sending workers home. I never anticipated anything of this magnitude that would affect not just Jefferson County, but our entire country and indeed the entire world. This is a time for working together, for putting partisanship aside, and talking to your neighbor. Do not go out in public when it's not necessary. There are plenty of foods in the food supply. Your county government will continue to operate and take care of your needs. We're in the process of reallocating our resources now to meet those needs. And with the help of the EMA, the Department of Health, the state of Alabama, and the federal government, we will make sure those needs are met. Your prescription, you will get your prescriptions. You will be able to get your foodstuffs. No one's going to cut your power off. No one's going to cut your water off. Everything's going to be fine.
Absolutely.
You're just going to have to change your social behavior while this has gotten under control. It's imperative that we become proactive at this and get ahead of the curve. If you can look at what's going on in China, you can see that the curve is now flattened out. And we're looking now for it to possibly begin a decrease in the number of new cases. So we anticipate that to occur here. But the goal now through these drastic actions that we're taking is to limit the exposure to the people. Those, if you've been infected, you're infected. What we're trying to do now through these unprecedented actions is to limit that exposure. It's important that you do that. We will keep your disruption to a minimum. And this is a time for prayer and working together. Being no further business, this
Mr.
meeting.
President, may I say this?
What's this?
Again, yes, sir.
As you know, March the 13th, the President issued an order declaring a national emergency. And that can only be done when the life of our nation is threatened. And it's such instances such as war, national disaster, other emergencies. This is one of those other emergencies, a threat. And we've seen it over and over and over, all the measures that are put in place. And they're put in place, why? To stop the spread. And there is no cure, there is no vaccine. This is a virus. The virus is a biological agent, and it can only live if it invades a living cell, in humans and in animals. This has crossed over from an animal, and now it's attacking human cells. The target is the lung tissues. And when that little virus gets in that tissue, it then starts reproducing inside that cell, and it will kill the cell. So the object is to try to prevent that cell from getting into your body, into your lungs, and then multiply. Sometimes it's a mild attack, sometimes it's more severe. Some of us are more vulnerable because of our age and so forth. So, we want to try to limit the exposure to that virus. We get all these wash your hands, wipe down, why? because the transmission of that virus, it's not like it's out in the air and you're gonna breathe it in. It comes out of droplets from the human, and from your saliva. And when you sneeze, most people don't realize it, but your sneeze comes out at 100 to 200 miles an hour. And then it spreads. Now, we see sometimes when I sneeze, you can see the droplets go out. But that's only the part you can see. Most of it you can't see. They're thinner than a hair. But in those, if you're infected, in those little droplets is one of those little coronaviruses. And if it lands here, then it'll stay there. The saliva will dry up, but the little coronavirus is still sitting out there. It's my understanding it can stay out there for 3 to 6 days on the surface. So that's why we're cleaning. That's why we're keeping our district. We don't want to be in that room. Most people don't sneeze in your face, but when you sneeze, it projects out. And so you want to keep that distance from the touch, the hands, everything that you touch. That's why we're cleaning. The light switches, the handles, everything that you touch, you're potentially exposed. But if you keep, and that's why we're doing all these other drastic measures, is that we, the more we keep distance, the more we keep the public from coming in and out, the less likely it is it's going to spread. But we're trying to limit the speed of the spread. We're in a situation that's, like Mr. Stevens said, unknown territory, uncharted waters, but we do know this. There's a tsunami out there. We don't know how big, we don't know how bad it'll be, but it's coming. So we have to do everything we can do to prepare for that, and that is to put obstacles in place. Put these measures in place to stop the spread. That's what we're trying to do now. And hopefully there'll be a vaccine. The SARS-2, the SARS attack in 2002, it came out of China, was another virus. Same thing, it attacked the respiratory system. In a polio virus, that's a virus, but it attacked the motor neurons in your body. So, but the SARS viruses attack your lungs. So the more we can keep SARS out of our lungs, better off we're going to be. And I'm one of those that touches the face all the time, so I'm going to have to do something to try to correct that. But anyway, we have to do everything we can to mitigate it so that we don't get a sudden surge of a lot of people needing hospitalization. And it's my understanding that the number of cases, or the number of new cases, will double every 5 to 6 days if we do nothing. So we must do something, we are doing something, and we're going to do it together, and I appreciate it, Mr. President.
Mr. Scales wants to readdress again also.
Thank you, Mr. President. I wanted again to reiterate, I am interested in making sure that I hear something that we're going to do as relates to seniors and them being informed on their level in terms of information being communicated accurately to that population. I'm also interested in those who receive information that fit within those categories that we know, as Joe was talking about, especially if you have a weak immune system and some other things, how we're communicating to those persons who may be more at risk. And lastly, I want to say this, and this is no throwout, this is just me being very honest to say that with this JIC, I would be interested in knowing, I don't know how we translate having one voice to not getting information. I'm interested in the information that is going to be provided, and I'm stressing that again because I'm not interested in sitting up here just talking and no one else is as well. So I'm not throwing off at anybody, and I don't care anything about that. I just want to be a part of it so that I'm actively involved in what's going on. So, even if it means we have one representative, that's fine, then I'm gonna hold to Joe and whoever else that is, to make sure that they're keeping me informed in terms of what's going on and how we can best get that information out to the general public. And so I just want to say that in closing before we leave. And no, we don't want folk to panic, but that's the reason why we also have to be very gentle in our approach as to how we put information out there. I think if we can overcome Ebola and some other things, or is it Ebola or Ebola? Which one is it, Joe?
Ebola.
Ebola. Then I know that we can overcome this, but you don't want people frantically trying to do some things. So again, that population that we know are at risk, and a centralized location so that folk can be able to get testing. I'm anxiously awaiting to hear that so that can be communicated to the general public, beyond those who can travel far to be able to get it. All right, thank you.
Following up on your seniors, we have been working with the mayors, with their seniors and their senior citizens coming to the center, because one thing that those centers do provide is a meal every day. So if we got your, the pastors and everything, we'll be needing some volunteers.
We already have closed them, Commissioner.
Yeah, the center's closed.
The centers are closed, and United Way will be, preparing to, distribute the Meals on Wheels.
Right, and that's what I'm saying, we can get maybe some of the pastoral community involved in that, that'd be a good thing.
And that's part of the bag, the lunches that will be served, and also in the hygiene items
All right.
for the whole county.
Ladies and gentlemen, there being no further business, this meeting is recessed until further notice.